So summary measures of health can help decision makers, researchers and citizens understand what the most important problems are. I don't think that's true. I think that's a big mistake. Global burden of disease estimates do not help us decide what the most important problems are. The most important problems are the problems that we have the most cost-effective interventions for. Now, people sometimes say, well, okay, maybe it's not good for allocating, deciding what the public health priorities are, but it's better at deciding what the research priorities are. Maybe. But I'm not completely sure about that, you see, because I think research is similar in actually we should invest in the most cost-effective research. And we should be thinking, all right, what's the information yield from this research? How much does this research cost? And comparing the information yield with the cost and funding first the most cost-effective research. In terms of comparing health of communities over time, I just don't think. I mean, this doesn't work for obvious epidemiological reasons. You know, like things go up and down for all sorts of different reasons. This is the age-standardized mortality in Russia by region, and there was a big peak and jump in mortality in Russia when economic situations. So it doesn't really tell you about the performance of health systems or anything like that. The things that make disease go up and down in populations are often they're macroeconomic things. It's not about provision of health resources. And if you want to monitor the performance of health systems and make sure health systems are accountable, that health systems are doing the right thing, there are much better ways of doing it. So first of all, you use rigorous epidemiological methods to establish the cause-effect associations, So if it's a disease, a cause of disease, say smoking. So smoking causes lung cancer and loads of other diseases. So you find out the link between the exposure and the outcome by using good research designs. And then you monitor smoking. You stop monitoring you forget then about lung cancer. You don't have to count lung cancer, you just have to count smoking. And you try and reduce the cause, or you reduce, and then, and then this is for another example from my own research. So like we found in the CRASH-2 trial that this drug, very cheap drug, tranexamic acid, reduces the risk of death due to bleeding in trauma patients. And we did cost-effective analyses that shows it's highly cost-effective. It's not more cost-effective than insecticide-treated bed nets. So we've done the calculation. Insecticide-treated bed nets are a better buy than tranexamic acid for trauma. Tranexamic acid for trauma is very close behind, but if there was only so much money to go around, you should say, look, actually don't spend it on this. I know this is my particular interest, but that doesn't matter. Don't spend it on this. Spend it on insecticide-treated bed nets, because you'll save more lives with the same amount of money. But once you've found in a randomized trial that this treatment works, then you don't have to measure trauma death rates. You just measure which hospitals have a policy of giving it. And so, these are hospitals with a policy of giving tranexamic acid. So all different countries of the world. So, and there are some hospitals in the UK that don't give it. Now, whatever their mortality rates, they would be better if they used it. So you can forget about, you don't have to know you don't monitor their burden or their mortality rates or anything. You forget about that. You just monitor whether they're doing the things that they should do. based on epidemiological evidence, you know. This treatment works. Are you giving it? Yes or no. If you're not, then whatever your death rates are, they would be better if you did it. So you're not a high-performing hospital. And that way, you sort of remove stigma, you know. That means, so like, you know, I find this with, I don't know, hospitals, people from the, you know, people might say, you know, my hospital is the best hospital in the world. It's got all of these machines and fancy gadgets and, you know, very high tech. And you say, well, look, just come up with a list of effective interventions and ask them, are they doing it? What proportion of their patients receive these interventions? And then you can really tell if they're a good hospital or not. But when you see all of these, you know, the technology and everything doesn't mean anything. You know, are they doing the interventions that have shown to be effective and cost-effective in randomized trials? If they're doing them and all of their patients are receiving them 100% as close as possible, then they're a good quality hospital, whatever their death rates are. If they're not, they're not. So the global burden of disease study, I think, is sort of led to a sort of epidemic of, it's a kind of academic folly, and it sort of, I see it in my university a lot. It's like say this is this is a leader in mental health, right? So he says, and these are people over here. These are his followers. These may be people suffering from depression, right? And you know they say, look, this problem, your problem, is a really big problem, and I'm your leader. You know, I will lead you to salvation. Follow me, right? And they get huge followings, you know, and they become very famous, not for doing anything useful, for just declaring that their problem is big. And you know, lots of people there are many more people in my university who declare problems than who solve problems. Because, you know, you can get if you want to get famous very quickly, you know, declare something's a big problem. Because there'll be lots of supporters out there who will want to get behind you and say, yeah, you know, yeah, that's a big problem, you know. And the journals love it. You know, there's every week in the Lancet, there's some special series saying some new problem is the most important problem. And every day, you know, there's a you know, Lancet Commission on stillbirth and Lancet Commission on, I don't know, rare neurological diseases. You know, they love to declare emergencies. But I think, you know, if you get a lot of people around you in your little army of saying your problem's a huge problem and I'm your leader, unless you can do something for them, I don't think, you know, you're not helping them. And so, you know, I think there's ways to spot honest advocates.